Hello and welcome to the online training module called It Makes You Feel Much Better About Life, Journaling to Support Addiction Recovery, Implications for Child Welfare. My name is Amy Krentzman. I'm an Associate Professor of Social Work at the University of Minnesota. I'm presenting this module with Bonnie Horgos, a doctoral student and research assistant in our program. This training is a collaboration effort with the Center for Advanced Studies in Child Welfare at the School of Social Work at the University of Minnesota. This training module is part of a larger online training effort by the Center for Advanced Studies in Child Welfare that covers a wide range of topic areas in child welfare. In this module, I'm going to talk about journaling in general and journaling to support addiction recovery, including the current research findings in this area and research I've done on a journaling practice I've developed to support addiction recovery called positive recovery journaling. We will also talk about implications for child welfare practice and provide a bonus module on how gratitude supports addiction recovery. Welcome to this module of the online training series. We're glad to have you with us. A little bit more about the presenters. As I mentioned, I'm Amy Krentzman, and I do research on addiction recovery. And this means that over the years, I've done research on spirituality, gratitude, forgiveness, 12-step programs, sober living houses, journaling, which is our topic today, and the experience of getting and staying sober in rural communities. I teach the addiction elective course at the University of Minnesota School of Social Work. I give lectures, webinars, and trainings in the community. And I've done a number of these learning modules for child welfare workers. Next, I'll have Bonnie Horgos introduce herself.
Hello, my name is Bonnie Horgos, and in these modules, I will be presenting on positive recovery journaling and how it relates to child welfare. First, however, I just wanted to quickly introduce myself. I am a second-year PhD student at the School of Social Work, where I work with Dr. Amy Krentzman as a graduate research assistant. I am interested in researching alcohol use, misuse, and disorders. Prior to starting the PhD program, I graduated with my MSW from the University of Minnesota School of Social Work, in which I also interned at the Ramsey County Public Defender's Office and the Native American Community Clinic.
And now, before we begin, just a moment for me to express my gratitude to my collaborators, my research assistants, to the treatment providers who allow me to come into their facilities and conduct my research, and for the people who fund my studies. Thank you so much to everyone. This module series was made in joyful collaboration with the Center for Advanced Studies in Child Welfare. These modules are made possible with the generous support of federal Title IV-E funds by way of a grant from Minnesota Department of Human Service, Children and Family Services Division. And before I go on any further, let me just stop and say thank you to you, the child welfare workforce. It's not lost on us how hard your jobs are and all of the wonderful work you do on behalf of children and families. Thank you so very much for all you do. This module has 3 parts. In part 1, I'm going to introduce you to positive recovery journaling as well as some of the background research that supported it. In part 2, I'm going to explain 2 studies I've conducted of positive recovery journaling, including what the studies looked like and what the results are. In part 3, we're going to talk about implications for child welfare. So specifically in part 1, which is this module you're listening to now, I'm going to provide a definition of journaling. We're going to talk about common elements in journaling of all kinds. I'll talk to you about background research that supported my development of positive recovery journaling. Then I'll present positive recovery journaling. I'll have you have a look at the journaling pages themselves, a values clarification exercise that's part of the journaling package, and talk about the idea of setting attainable goals, which is also part of the journaling intervention. What is journaling? If I were going to ask you what is journaling, you might say it's when a person grabs a notebook with lined paper, they grab a pen, and that it's a private act where they write out all that they're thinking and feeling. You'd be right. I think that is what most of us think of when we think about journaling. Now, when I give talks in the community, I pause and I ask people whether they personally have or have had a regular journaling practice. So I wonder if this is the case for you. I notice when I ask this question, about 20% of the audience will say yes. Right now in the public domain, commercially available, are all different kinds of journaling approaches. There's bullet journaling, there's the monk manual, there's Julia Cameron's suggestion, which is to do morning pages, writing for 3 pages every single morning as a way to enhance creativity. And even I noticed that Oprah recently came out with the Life You Want planner. And similar to some of the other journaling techniques that are out there, Oprah's work gives prompts and people write answers in response to the prompts. When I give talks in the community, I next ask the audience whether they have recommended journaling to clients. And I wonder if that's true for you. Have you recommended journaling to clients? And usually about 80% of the people say yes. My next question for people in the audience is, if you have recommended journaling to clients, did you teach them how to journal or did you recommend a specific approach? And the answer I typically get is mixed. So some people say sometimes yes, sometimes no. And I wonder what the case is for you. In my study of journaling, not only positive recovery journaling that I'll be talking about today, but also learning about and trying out a wide range of different journaling practices out there, I've come to the conclusion that I feel there are 3 elements that are common to all forms of journaling. One is this aspect of privacy, this sense that it's safe to say everything on these pages because no one else is going to be seeing this, and I can be completely honest when I'm writing. There's an aspect of self-expression. There's an aspect that I'm going to pour out everything in my heart on these pages. I'm going to get it off my chest. I'm going to get relief from having expressed myself. And finally, this idea that as I write, I'm going to figure something out. I'm going to derive some insight. Something that I wasn't thinking about before is going to become clear to me as a result of writing. And I believe that these aspects are involved in all of the different kinds of journaling practices I presented, as well as the one I'll be presenting to you today. This line of research for me started with a couple of questions. How might journaling support well-being, and how might journaling support addiction recovery? Now, these are really almost the same question, because if someone's well-being is enhanced, then that is going to reinforce their recovery from addiction. Here is some of the background research in journaling that led me to develop my own journaling approach. There has been a body of research on journaling, and 2 different kinds of journaling dominate the research literature. One kind of journaling is called expressive writing. With expressive writing, the instruction is usually this, that a person doing expressive writing is asked to write about the most traumatic experience in their life every day for 15 to 20 minutes for 3 to 5 consecutive days. And the benefits of expressive writing are this idea of expressing, finding relief from the stress of holding it in by way of written expression. Research on expressive writing has shown to benefit physical and in some cases psychological health. There have been 3 studies that I found on expressive writing applied to addiction, and basically the main takeaway from those 3 studies is that there was some benefit for about 2 weeks after the exercise, and then the benefit went away. Another type of journaling that's found in the research literature is called interactive journaling. Interactive journaling looks like a colorful magazine, and within its pages will be some didactic information about substance use with an opportunity for the reader to answer a set of questions and to write directly into the booklet with their answers. Research on interactive journaling has been shown to improve knowledge about alcohol, to foster willingness to change, and to reduce recidivism among those with addictions who've been incarcerated. Here is a larger blow-up of the interactive journaling example page, and these are published by an organization called the Change Companies. These modules have a link that connects you to further readings, and you'll see some citations to a couple of examples of these interactive journaling magazines. The next body of literature that I used to develop the journaling practice I'll be talking about today are interventions that make recovery more reinforcing. And again, if people find that the experience of recovery is more reinforcing, they are going to do the hard work needed to stick with it. The first intervention I want to talk about is called behavioral activation. Behavioral activation involves planning and enacting rewarding activities that flow from personal values. In other words, it involves setting daily goals that line up with what is most important to you in life. Behavioral activation has roots in cognitive behavioral therapy. Remember what you know about cognitive behavioral therapy, that what a person thinks affects how they feel, and it affects what they do. Well, behavioral activation looks at it in a slightly different way. They look at it from the vantage point that what we do influences how we feel and what we think, with the idea being that behavioral activation can be an intervention for depression. If we can help people with depression to do things that are meaningful to them and pleasurable to them, it will improve their mood. And recently, behavioral activation has been applied to addiction. The other set of interventions that are really designed to make recovery from addiction more reinforcing are the set of interventions from positive psychology. These are interventions designed to improve mood and well-being, like gratitude practices, acts of kindness, savoring, and also activities related to identifying an individual's personal strengths. Both behavioral activation and positive psychology have been shown to improve mood and reduce addictive behavior among those with addictions. Both of these interventions, behavioral activation and positive psychology, very often involve writing. This research I've described has informed the development of positive recovery journaling. Expressive writing has focused mostly on negative events. What about a journaling practice that focuses on what is going right with recovery? Interactive journaling has focused primarily on the initiation of behavior change. Well, what about a journaling practice that focuses on the maintenance of recovery? Behavioral activation and positive psychology have shown benefit for people with addictions. What would happen if we combined them? This led to the development of positive recovery journaling, which I'll introduce to you now. What you see here is the standard blank positive recovery journaling page. The center of the book, the spiral binding, represents now, the present moment, and participants are invited to review the last 24 hours on the left-hand side of the page and plan the upcoming 24 hours on the right-hand side of the page. The person is given prompts, as you can see, and they're invited to make a list of bullet-pointed items under each heading. So a person is not asked to write longhand in a paragraph form. They're invited instead to make bullet-pointed lists. And a person would complete one of these pages that you see every day. We start with the left-hand side of the page, where people are invited to make a bullet-pointed list of all the good things they could possibly think of that happened in the past day. And the hint is that small things count. People then are invited to make a list of all things they can possibly think of that they are grateful for. We also have a section here where people are invited to write down a list of any bad things that happened in the past day. And that serves a couple of purposes. First of all, it allows people to compare good things that happened to bad things that happened, which can be very useful to people. It allows people to take a realistic snapshot of the day so that their experience writing in the journal is an authentic expression of real life. And finally, a bad things section allows a person to notice over time if a bad thing persists day to day, it's a signal for them to get help. On the left-hand side of the page, finally, a person is invited to make a list of good wishes for other people. They're invited to stop and ponder other people at that moment, people who've had surgery, people who are suffering now, stories they've heard in the news, and to make a list of people who they're thinking of on that day and who they're wishing well. On the right-hand side of the page, people are asked to make bullet-pointed lists that represent their plans for the upcoming day along the lines of certain categories: work and education, home and housing, joy, things that would be enjoyable and pleasurable, health, recovery, spirituality, community, social, financial, amends and repair, and 2 blanks at the bottom where someone can write in a topic of their choice. The purpose of these categories on the right-hand side is to help a person plan a day that is balanced as well as a day that is oriented toward recovery. This is a composite entry. These are participants' own words, and the number of items under each category represents the average number of items for the first research study I conducted. Feel free to pause the screen and read over these entries if you're interested. When I teach positive recovery journaling to a group, I teach the left-hand side of the page, and then before I teach the right-hand side of the page, we pause and step back and we do something called a values clarification exercise. There are a couple of reasons why I included a values clarification exercise within positive recovery journaling. One is that writing about core values has been shown to strengthen people in the face of adversity. Another is the opportunity to teach people how to write goals in a way that will enhance their success at getting them done. You might have heard of SMART goals, and in the behavioral activation world, they talk about writing goals so that they're measurable, observable, and the next small step. Writing goals in this way helps a person to get something done. It also gives them a reward in the short term, even if their goals are more long term. We start with the right-hand side of the positive recovery journaling page, and I ask participants to consider these important life areas and to choose the one that's calling to them most strongly right now. Then I have them answer a set of questions about the important life area that they have selected. What makes this life area important to you? What do you believe strongly in this area? What do you long for in this life area? If this life area were going well, what words would you use to describe it? This is an example of a completed values clarification exercise. These are the words written by a participant in one of my research studies, someone who chose recovery as her important life area at that moment. And this is the essay she wrote in response to the questions. So go ahead and feel free to pause the video if you'd like to read this over. The next thing I do is I invite participants with the bullet points you see in the lower right-hand side of the page. I invite them to write out 3 actions they could reasonably take today that would help them move their lives forward in the vision of what they have written. So someone might write step work, find a meeting, and housing. Then what we do is we pause and we learn about how to write these action items so that the person has the greatest chance of success. What I've begun to do is show a table like this when I'm teaching this part, where there's a fantastic goal in the middle column and an even better goal on the right-hand column. And I give them several examples from several different life areas. For example, right in the middle there, health. Using a heating pad is a fantastic goal. Using heating pad for 20 minutes when resting after group today is what I call an even better goal. I have participants read this over, and then I ask them, what is the difference between the fantastic goal and the even better goal? And then they, of course, go on to say that the even better goal is more specific, it's more detailed, it tells you when the thing is going to happen, for how long it's going to happen, where it's going to happen. And in this way, participants learn how to write their goals in this more specific way. We then go back to the important life areas worksheet, and where they had formally written step work, find a meeting, and housing, I give them the opportunity to rewrite those goals so that they're in the spirit of the even better goal. So step work becomes, this afternoon, spend 1 hour on first chapter step work in a quiet location. Find a meeting becomes, after lunch today, go online and find a Thursday night AA meeting nearby. Housing becomes, sign up for time at the computer to look up sober living properties. Once we do the values clarification exercise, the person then has the skills to be able to apply that technique to the right-hand side of the page. They don't have to make the bullet points measurable, observable, and the next small step for each and every bullet point on the right-hand side of the page. But if they have something that's especially difficult or challenging, then that's now a skill they have, so they're able to write that bullet in that way and enhance their chances of success. This concludes part 1 of this module. We've defined journaling. We've talked about common elements in journaling. I've presented background research. I've introduced you to positive recovery journaling, including the main journaling pages, the values clarification exercise, and the idea of setting attainable goals. Please join us for part 2 of this module, when I will present to you 2 research studies I've conducted on positive recovery journaling, including the results of these 2 studies. Thank you so much for your time and attention. See you in part 2.